Hi everybody, this is Dr. Malhotra. I'm a medical director in neurobehavioral clinical research in Canton, Ohio. Today I will be speaking a little bit about migraine headaches. It's a huge public health problem. Almost 22% people suffer from migraine headache. Majority are women. They are usually the ages of 30 to 55 years. There's a myth that men don't suffer from migraine headache, but they do. It's 6%, 6 in 100. Out of these 22%, like 22 out of 100, only 23% get treatment for migraine headaches. 50% are not finding their treatment satisfying. So in a year, $13 billion are lost for loss of work related to migraine. This is the time for us to develop new effective treatment for migraine headache. Migraine starts as an episodic disease. Usually it is a headache which can be unilateral or bilateral. It lasts from 4 hours to 24 hours to 72 hours. It can be divided into two kinds. One is the migraine without aura and migraine with aura. Migraine without aura is very, very common. There is a big myth that if you don't have aura symptoms, you're not having migraine headaches. That's not true. It starts within 3-4 hours. You can start having nausea. You can have vomiting, light sensitivity, touch sensitivity, weird smells, and it can happen in the sense which is related to a trigger. Any stressful situation can predispose to that. Most people like to not bend over or like to not do any activity they are doing, and they usually do not have any other aura symptoms related to it. Migraine with aura happens more in women, and it can lead to serious consequences. Usually it can also lead, rarely, I apologize, it can lead to complicated migraine and stroke as well. So prevention of trigger, healthy lifestyle is very, very important. But above all that, we as physicians are working harder to identify patients appropriately, make sure that you are reaching out to your doctor. If you are having headache quite often, it starts as episodic headache, and 75% patients don't even get treatment, so they end up using aspirin, Excedrin migraine, over-the-counter medication, which are effective, but there is a very clear data. If you continue to use those medications, that can predisposed to more rebound headache, which can lead to chronic migraines. So in 5 years, 20% of these acute migraine can convert into chronic migraine. So do take migraine headaches seriously and get treatment available for that. There's a great book on migraine to understand how to get treatment for it. It's the Migraine Solution Complete Guide of Diagnosis and Treatment by Dr. Paul Rizzoli, MD, and Elizabeth Loader. And there is a chapter, How to Find the Right Doctor, which read about it. The current agreement in experts is that you need to work with your patient in a shared team approach. Give them headache diaries so they can really write about their headache quality, the trigger point, how long it lasts, just like diabetics do diabetic diary, to figure out the exact kind of migraine headaches you are having. The most treatments right now, like triptan class of medication or glutamines, they are effective for patients, but their effectiveness is poor in patients who have a lot of nausea and vomiting or gastroparesis, and those are majority of patients. So there is a need for new treatments. Moreover, you cannot use those treatments in patients with cardiac risk diseases because they can cause flushing and chest pain. A lot of people don't like taking those medications because they cause serious side effect as well. But when asked if you would take a medication which can completely stop the headache versus having more side effects, most patients chose to have a medication which will early stop the migraine headaches. So people suffer a lot. Majority of patients don't understand. Majority of family members of patients don't understand how bad they feel at that moment because they don't suffer from migraine headaches. There are cutting edge new treatments coming out in the market. The migraine is produced by some peptides, the CGRP peptides, which are released through your vessels and meningeal vessels in your brain. And those peptides create a cascade of wave of pain or lead to the pain nerves to work. And there are new antibodies which are being developed for these peptides, which can prevent chronic migraine or prevent the acute migraine to convert to chronic migraine. So there are some very, very exciting programs or trials at this time. I would encourage most patients to participate in it. Not only that would help them to educate themselves about the kind of headaches or migraines they are having, or rule them out if they are not having a migraine headache. A lot of patients in migraine field don't participate in the trial, unlike the multiple sclerosis, diabetes, hypertension, because the awareness is very low, and because everybody suffers headache, they minimize the headache, or it seems like people assume it is a willpower and you should be able to suck it up and work through your daily routine. But the patients who truly suffer from migraine headache know how debilitating they are, and we seek out to you to participate in clinical trials so there are new effective treatment available for the migraine treatment. Clinical trials are very scientific method of assessing the diagnosis, the options, and in fact some people assume they are guinea pig, but in fact scientific trials really safeguard you in a lot of different ways. The doctor's job are to make sure any side effect is appropriately reported. Your participation is completely voluntary. The doctors who are working there would give you enough time and options available, and if they feel the trial is not right for you, they will be the first one to ask you to choose another option. With that, I will open it up for questions and wish you good luck finding good care for your migraine headache.
Okay, so it looks like the first question that we have here is, can migraines cause tingling to your arms and legs?
That's true. The migraine with aura can cause tingling to your face, your arms and legs, and usually it is reversible. It should go back to normal, and that's why some people like to recommend the riboflavin, which is one kind of vitamin which can prevent some of these symptoms. And this is why aura like migraine can be related with stroke-like symptoms. So take it very seriously if you are having those symptoms.
Okay, thank you. And then the second question we do have is it a proven fact that the use of daily melatonin reduced migraine frequency?
Not that I know about. I can check into it more, but to my knowledge, there is no study which has proven that.
Okay. Also, is blood pressure linked to migraines?
There is no direct link, but during the migraine headaches, you can have more because it creates anxiety, it creates pain, so you can have high blood pressure findings which are truly reversible. There is a significant comorbidity with migraine. If you think of migraine as an inflammation, you are affecting several body parts during that extreme stress. There's well known that 70% patients suffer from other comorbidity like allergies, asthma, blood pressure, obesity, anxiety, and depression. That clearly shows that the suffering is real and people have a quite serious debilitation due to their migraine headache.
Okay. The next question is, what are the latest triggers discovered for migraine?
There are a lot of triggers, and by the way, they had a study in France where they checked if the preventing the trigger can stop the migraine headaches, and they didn't find a true relationship, but there is well-known literature on trigger causing headaches. So the common ones are stress, if you're not eating right, if you're not well rehydrated, alcohol is well known. There is a new study which came out last month where people who are attached to their cell phone, the waves can lead to higher migraine, or the blue light which comes out of it can create more migraine. Nutrition, sleep, stress, they are key triggers related to it.
Okay. Another one of our viewers want to know, she says that migraine has caused her jaw pain. She wants to know, is that normal?
There can be, yes, if long-term effect of that can be that unless you have independent trigeminal neuralgia, which can be a comorbid finding, migraine can cause different aura-like symptoms and can mediate to jaw area. A lot of patients complain about that. Is there a true research on that? Not that I'm aware of.
Okay.
But she definitely need to get checked and rule out any other comorbidities, and definitely get treatment for migraine, because maybe during the pain she clenches her jaw a certain way, and that can create long-lasting results.
Okay. Another one of our viewers wants to know, is it possible that migraines are often caused by tension headaches?
Migraine are not caused by tension headaches, but tension headaches are very common in patients with migraine. So, in fact, 50% patients with tension, in one study, 50% patient with tension headaches had probable migraines. So more than not, I think patients with migraine headaches, especially women themselves, are not taken seriously when they complain about headache. And I think it's our responsibility as a physician to understand and ask more questions, but I would ask patients to be more assertive in bringing that to their doctor, keep more headache diaries with details on when the headache started, how long it lasted, what other symptoms, like somebody asked about the numbness in arm. Some people can have blurring of vision, complete loss of vision in an eye, but then it will come back. Some people have difficulty speaking, dizziness. So those are all aura symptoms. And for non-aura kind of migraine, you can have nausea, vomiting, sensitivity to light, touch, smells. Do write all those symptoms. Do also write trigger. You would be surprised that if you start writing triggers, what more you would find. What are the key triggers for you which precipitates the migraine?
Okay.
And one thing I forgot to ask and tell in triggers, like beside improving your sleep and restfulness and eating right and staying away from alcohol, exercise has been shown to be very, very effective in not preventing, but definitely giving some help to the patients.
Okay. Another one of our viewers here would like to know, do migraines cause memory loss? She says, sometimes my brain wants to say something, but it comes out as something else. Could that be a side effect of migraines?
Usually it should not be a side effect of migraine, because most migraine related, it's a neurological disorder, but most symptoms are reversible. But there are some medications which are prescribed for migraine, because in fact, medication wise, we are not providing a significant benefit to patients. So there are some prophylactic medication like Topamax, which is a great migraine medication, but it can cause serious side effects like word finding difficulties, which it seems like somebody is complaining about.
Okay.
And if they are having that, they need to get that checked.
Okay. Another one of our viewers would like to know, does low BP cause migraines?
That is different kind of migraine. It is usually in the back of your brain, hypotensive experience. And yes, low blood pressure can give a headache, but not a migraine.
Okay. Another one of our viewers, she says that she's had seizures when she was young. She wants to know, is that why she may have migraines now?
Yeah, there is a comorbidity between seizure and migraine headache, just like several other comorbidities we discussed about. So yes, there is a brain process where her brain is more sensitive to certain kind of proteins, like we talked about CGRP, and a lot of new medication trials are trying to work on it. In fact, one just got approved, which is very, very expensive. So this is the high time to participate in clinical trial and find out more about your disorder and be part of this movement.
Okay. Another viewer here wants to know, can aura with migraine actually make you lose your sight altogether, permanently?
Not permanently. If it is, and not that I'm aware of, complicated migraine and migraine which are with aura can cause that, where you have temporary loss of vision, but it should not cause, unless that led to a stroke, it should not cause the permanent loss of eyesight.
Okay.
So definitely it needs to be, other comorbidities needs to be checked.
Okay. Another one of our viewers says, are there any new treatments / medications for those of us with migraines with aura who do not respond to triptans?
Yes, there is one new, I don't know if I'm allowed to talk about it, but one new drug in the market just released last year, which is the CGRP protein antibody, and that's first of its kind. This is it's very expensive, which kind of is counterproductive, but I do understand there must be issues behind it. It's $10,000, I believe, per injection, and there are 3 other companies who are running trials similarly. We are running a couple of those trials. They are against CGRP antibody. You can go on clinicaltrial.gov or give our office a call, or wherever you live near your office. There are almost 50 sites in United States which are offering these medications for free, no charge. And there is, of course, a placebo arm, but there is a chance you can get medication. If nothing else, you can down the road get it and find out about it.
Okay.
So there's a great future. This is breakthrough medications which we are trying to get out in market.
Okay. We have a lot of questions coming in here.
But this shows like how many people are suffering. They are suffering like with no help. And I do believe majority of, as our data suggests in 2015, that 50% patients don't even get prescribed or get diagnosed appropriately or go to see a specialist or get adequate treatment. And out of those patients, only 20% patients have adequate response to it. So it's a huge public health issue.
Okay. We're going to do one last question here, and then we'll take the rest of our questions. I also wanted to add that you can find sites near you at clinicaltrials.gov near your location. The last question we're going to hit here is Cheryl thinks that she finds perfume smells a lot stronger and hurt her head. Then that night she'll wake up with really bad migraines. So she would like to know if that smell is her aurora.
Yeah, exactly. You are having extreme sensitivity to smell, and again, it's like it could be one of your trigger. And the best thing I would recommend to you is you keep a headache diary, and every time you have those kind of symptoms, you write down how long the headache lasted. This would help your doctor tremendously to help find right treatment for you.
Okay. This was a really good question as well, so I'll just throw this last one
Everybody
in there.
has been amazing. Means I'm impressed how all of you out there are seeking answers and help. And I would repeat the book, try to read it, The Migraine Solution. It is complete guide of diagnosis, treatment, and pain management by Dr. Paul Rizzoli, MD, and Elizabeth Loader, MD. out of all the books I've read, it's kind of one of a really good one for patient information.
Okay, so we just like to take the time out to everyone today and taking the time to tune in and ask questions. Like I said, if you do have further questions, we can answer those at our Facebook page. But other than that, we hope everyone has a great day.
Thank you everybody for listening in, and hope you have a migraine-free day today. Thank you.
Thanks.